Nigeria has joined other well-meaning nations of the world in a race towards 2015. The prize is to achieve the Millennium Development Goals, 8 international development goals that were officially established following the Millennium Summit of the United Nations in the year 2000, after the adoption of the United Nations Millennium Declaration. All 193 United Nations member states and at least 23 international organizations have agreed to achieve these goals by the year 2015. According to the Millennium Development Goals Report 2012, by working together, governments, the United Nations family, the private sector and civil society have succeeded in saving many lives and improving conditions for many more all over the world. However, in the years ahead, every nation has the opportunity to achieve more by intensifying efforts to reduce inequality, press forward on food security, maternal health, rural development, infrastructure and environmental sustainability. Nigeria has made substantial progress in the journey towards 2015, especially in regards to reducing poverty and maternal mortality rates. As at March 2012, the Conditional Grant Scheme, which is a poverty reduction strategy, has been extended to 113 local government areas across all of the states in Nigeria. The Senior Special Assistant to the President on the Millennium Development Goals, Dr. Precious Gbeneol, took the MDG's message to the grassroots in Nigeria's capital Abuja when she embarked on an advocacy and sensitization visit to Bwari Area Council to sensitize the residents of the area council on the need to take ownership of the MDG's projects and on participation of the community leaders towards the achievement of the goals in 2015.
If things have been put for you in place, you can do better. You can use them. Not only using them, you can maintain them. In one of the places I went, the tap was just running. The tap head was free will. The water was just flowing. When I asked, that place that was in Abuja, when I asked, why is this tap not working? They said, it's evidence to show that the tap is running. But that is not really evidence. I wanted it to be locked and then open when it ought to be opened. Maintenance and security comes in. The chairman talked about vandalization. We don't want our things to be vandalized. A lot of money, you can hear it. Federal government has given over 4 billion. FCT has put over 3 billion. So between the two of them, you've gotten more than 7 billion. From 2007 to date, or from 2006, when the RG fund started, to date, and we are still doing more. So the quantum of money that has come into it should be used, maintained by you people. Our work will be done. When all of us look at all the things that are in place and we use them. And I'm also happy the conditional cash transfer is also working. People are being picked out of the streets to be given training that will reduce the excessive crime that we're having. More to it. Very importantly, there are drugs presently for other illnesses, like malaria that can kill your children. There are mosquito nets, like the hospital. There are HIV drugs. Because if you use those drugs, my prevalence will fall. If my prevalence falls in FCT, it will accumulate to my national prevalence falling further. I don't know if we're getting it. But if you stay in your house, they put hospital, 30 hospital. I'm waiting until the next hospital is by my doorstep so that I'll just move from my house here and enter the hospital. It will not do well. Or you have HIV, you begin to hide. I don't want my neighbor to know that I have HIV. Initially it may not be written in the face, but later it will be written on the body. Everybody will know that you have HIV. Then you say that somebody has done you medicine, and you be shima the relay. Is HIV embryonic parents. So that is what part of the MDG is all about. Then we'll talk about the water and sanitation. And because MDG in Nigeria is not a local thing, it's an international thing, it's a global thing. We need to interact with other countries and work minds to say that, yes, and these are our checks. In this area, we're doing well. We can feed our people. The people in FCT are no longer poor.
The Federal Capital Territory Administration, through its Department for Economic Planning, Research and Statistics, carried out a baseline survey in 2008, which revealed that over 70% of FCT residents earn below 50,000 naira per annum, and they are mostly farmers at subsistence level. The findings of that survey motivated the FCT MDGs Office to open up 234 community farms of about 2,340 hectares in the 6 area councils, and now over 24,000 rural farmers have been empowered and engaged in profitable farming enterprise. 15 John Deere Tractors and 75 motorcycles for extension workers were procured and distributed, along with 31 trucks of fertilizer to the 234 communities participating in the Community Empowerment Agricultural Initiative. Seeds, pesticides, wheelbarrows, weighing scales and sprayers were also distributed free of charge to participating communities. This goes a long way to meeting Goal 1 of the MDGs, which is to eradicate extreme poverty and hunger. The MDGs farmers in Ubosharu community in Bwari Area Council joined the scheme in 2010 to cultivate maize and bene seed, while those in Dokuma, a Kaduna border town in Bwari Area Council, chose to cultivate ginger because of its huge export potentials. Now these local farmers are being referred to as millennium millionaires because they can now boast of houses of their own and their children are attending school again after a good harvest.
I'm
happy with this program of MDGs. At the MDGs training in Bwari, we were trained on how to take care of our livestock, like chicken, goats, fish and other animals. I now have a poultry farm of my own, courtesy of MDGs, which I rear chicken. I've improved a lot on my farming skills, thanks to MDGs. As a single ginger farmer, I rarely get plenty produce, but now I yield more produce than I get before. I now know how to apply pesticide, herbicide and fertilizers.
I have benefited a lot from this MDG program. The past 2 years have improved my life and that of our cooperative, and we are very, very grateful.
It is through this MDG I start to farm maize. So I can tell you, since last 2 years, I never eat even Guinea food. True to God, I'm talking to you. I have already familiar with this maize, that this type of maize that they brought for us is very white. So true, I know the chop even Guinea maize again. Before it is Guinea and millet. I used to chop, but today it is maize now I depend on. So inshallah, I can say today that I'm talking to you, I have on my own yam under through this MDG about 3 heaps of yam today, inshallah. My son Abdulaziz, that I cannot even able to sponsor him before, I took him to mechanic at Abuja. I now bring him back to home to this Ubosharu, because we have UB now in this Ubosharu. So under this MDG, I have money, I get money. After I sell my benefit, I now sponsor my son to school. Then, and the remaining, my small daughters, I now put them in the primary school, Ubosharu. Inshallah, I thank God. Even presently that I'm talking to you, last year, I built a house.
As our strategic withdrawal, after the first 2 years, this is the 3rd year, we exit most of our support for them because we feel that they have enough for them to continue. So that's to reduce the dependency syndrome. And this is what we have been preaching. And I think even today on the field, they were saying if today we exit, they have already come of age.
The Conditional Cash Transfer, CCT, is also taking care of Goal 1 of the MDGs. It's a scheme whereby cash is transferred to poor households as monthly grants for a period of 1 year on the condition that they invest in human capital development by sending their children to school and also access healthcare facilities provided by the government. Beneficiaries of the scheme are selected based on their needs. There are 15 beneficiaries each in Baukuchi community in Kuje Area Council and Keti community in Abuja Municipal Area Council Amak. They have been getting regular conditional cash payment of 5,000 naira monthly. 10 beneficiaries emerged from Toge village off Airport Road in June 2011. Now that they have enjoyed the full benefits of the scheme and have been successfully pulled out of poverty, they are now productive members of the society.
I'm very, very grateful to MDGs. This program has really helped me a lot. I don't have anything to say other than to say thank you.
I am grateful to the MDG because after the accident that left me this way, I could not help myself until God brought MDGs my way. At first, I was receiving 7,000 monthly. Then later, I was given 117,000. I used the money to buy goats to rear. Now, they have increased in number. If any need arises, I sell 1 or 2 of them, then use the money to solve my problem. I still have a number of goats at home, and I can show them to you if you want to see them. I am grateful to the MDGs, and I hope that they can continue to provide for us. I thank God for the government's intervention. As you can see, I am now old, and I can no longer engage in farming activities. Sending my children to school was almost impossible until the MDGs intervened. Now my children are back to school and we are all happy and grateful. Thank you.
For each community, in the 65 communities selected, we look at the vulnerable groups, such as widows, disabled, etc. These are the kind of people we select, because they fall under the category of people who cannot fend for themselves, not to talk of taking care of their children. So, and they have wards and children under them who need to go to school. We all know the essence of our education today. There were some old people whose children were dead, and they are already old. They cannot even take care of themselves, and those people taking care of them, their children are dead, and they left little children under them. So these are the kind of some of the people we selected, so that some of these children are already going to school. Because their parents are no more, they may not be able to continue with school. So we selected some of these people, and they will be paid this stipend on a monthly basis to enable them settle things like PTA, uniform, and other educational materials.
To achieve universal primary education, which is Goal 2 of the MDGs, 585 classrooms have been constructed for both primary and junior secondary schools in the FCT to accommodate 23,400 pupils. 21 classrooms were rehabilitated. 598 sets of classroom furniture were provided to these schools, and 1,680 classmate PCs were supplied to 14 junior secondary schools. Towards achieving Goal 3 of the MDGs, which is to promote gender equality and empower women, the FCT MDGs Office, in collaboration with 3 microfinance banks, provided soft loans to 1,000 women and youths. Also, 1,123 women have been trained in different skills to make them self-reliant and encourage entrepreneurship.
I'm doing nothing before. I'm a housewife. So from there, I said to sit down like this will not help me for my life. So I have a friend that she heard about this program. So she come and tell me whether I have interest on the program. I say yes. So far I'm doing nothing. As I went there for the program, I choose to learn tester because it's the one that will help me in my life and my family. That is why I choose to learn this tester. I started this tester business. From there, I used to do 2, 3 in a day. And each one, I'm getting for 400 naira out of it. So it's helping me a lot. Before, I used to depend on my husband to collect some things. At times, my husband will not be around. Before he come back, I didn't do anything. But now, before he come, I don't cook, do some things that I'm supposed to do as a woman at home. So for that, my husband is very happy with me. He's appreciating me now. So I will advise some women who are not doing anything to come up and learn something like this. And so now I have some people that are coming, they want to learn the business from me. It's because I don't have enough place to keep them. So, and I want government to help me with money so that I will find place and rent some small place so that I will train some women that are not doing anything.
When we started training, I was very, very serious because I know and I believe that I will make it through that catering of a thing. So that is why I'm serious there. And to God be the glory. I understand what they are teaching us there, how to bake cake, snacks, many things there. And the training is so fine and it's okay. They tried, the MDGs, they tried very, very well. The way they train us, I enjoy it. And when I was given an award, I never believed in my life that they would give me an award. But I was shocked and surprised when they called me that I'm the best student of the year. So I was very, very happy when I received my award there. So since there, I started my own catering of it at home. Although I didn't have shop for now, but I'm baking my cake at home, and at least I'm having customers.
We've learned so many lessons from our experience, and the most important lesson is that these youths are willing to learn, and they are willing to be engaged meaningfully. Because you can see that from the few that we have trained, even those of them that we have not tried to cater for, they've aligned themselves somewhere so that they can be useful to themselves. So that goes to show you that they are very resourceful and they are ready to learn if we are willing. And so I want to use this opportunity to call on the Education Secretariat to open up more vocational centers so that people will have access, because one of the challenges is they don't live nearby, and so to come to this vocational center is a Herculean task. So if they can open up more vocational centers with skills, dynamic skills, the youth will be willing to learn and make themselves useful.
To fast-track the achievement of Goals 4, 5 and 6, which are to reduce child mortality, improve maternal health, combat HIV/AIDS, malaria and other diseases, 30 primary healthcare centers spread across the 6 area councils have been constructed. 350,000 long-lasting insecticide-treated nets have been distributed to households across the 6 area councils in the FCT. 30 fully equipped primary healthcare clinics have been constructed and provided with medical personnel. 1,500 doses of anti-malarial drugs have been distributed free of charge in rural communities where sensitization activities are regularly carried out. The Melafia Mobile Health Delivery Program was judged the best rural health practice by the Federal Ministry of Health in 2011. This unique rural health initiative has been recognized and lauded by the 53rd National Council on Health, Intel Corporation Worldwide, World Congress on Information Technology 2010 in the Netherlands, and was admitted for presentation at the International Conference on ICT for Health in South Africa last September. The pilot community-based health insurance scheme in the Federal Capital Territory is now leveraging on the success of Melafia in most of the communities. Presently, 10 communities are at the first phase of the pilot scheme, while 10 more communities are currently being incorporated into the second phase. Chief Angulu Dogo, the village head of Kango, a community in Kuje Area Council, is grateful for the community-based health insurance scheme kicking off in his community. All of his 100 grandchildren, 21 children and 3 wives are registered to enjoy the health insurance scheme for just 1,500 naira each per annum.
early this year, they came and meet our dad at the chief palace. They tell them their aim and objective of this program, that the program is all about our health. Because human being, if you eat umbrella food, one day, you may fall sick. That this program is for our own health and is for our own good benefit. And with that, we handle the program as we handle the MDG program. So with that, they give us a forms. We went to a training and they give us form, and they will register as a household. You have to register you and your wife and your 4 children. Out of that, the number is 6 in household. And for that, you pay 1,500 naira for the issue of a card. If you still have a dependent, you still have to register that you want them to join this, to benefit this program. You have to register them, and per person you have to pay 300 naira. And with that, our people have been compliant. Some did comply. But those that comply, in short, now they have something very tangible to even bless the MDG program. And with that, with this introduction of a card, I was first sick last 2 weeks. And with this card, I was treated, and now I am sound. And the same time, my wife too, she was pregnant, and it was last 3 weeks that she delivered a baby boy. And it's through this program that the baby is sound and well. And the same time, I still have my daughter, Akbare Zifania, and she was fell sick last month. And I took her to primary health care at Kuje. So they treated her, and she's fine. And likewise, this is my elder brother's wife, Abuja Solomon. She's one of the beneficiaries too. Every 2 weeks, with this my Lafia people, they do come to our village Monday, Wednesday. If you have a complaint of sickness, then you take your card to them. They will give you medicine and they will treat you. This is my second wife, brother, my elder brother's second wife. Her name is Hawa Solomon, and she was one of the beneficiaries too. In terms of sickness with their card, if they are sick, they will take the card to the primary health care, and they will give them their medicine. And likewise, this is his son. He was having one umbilical that had been something that nature, and he was operated through this MDG program. And with that, before he did not even know how to even walk himself for him to even run. But now, he's fine.
If the community, the household in the community can contribute 1,500 and government is bringing 13,500 naira, it's a welcome development. And many communities have showed interest. You know, they've been contributing and wanting us to reach them.
The innovations we've been trying to come up with, particularly the ambulance issue, we have discovered that the ambulance we are using in the FCT are the ones that do not get to the rural communities. So what we decided in 2011 CGS, we talked to CFO Motors, and the Pajero Jeep was converted to an ambulance because we believed it's only that kind of a vehicle that can get to the rural communities where there are patients that need to be moved to a tertiary or secondary facility. That ambulance can go in, pick the patient, even if it is a very bad terrain, the ambulance is suited for that kind of environment to move the patient to a facility where the patient can be attended to easily. Ensuring environmental sustainability and developing a global partnership for development, which are goals 7 and 8 of the MDGs, have been enjoying attention from the FCT MDGs Office. A standard environmental code for effective management of the environment has been developed. FCT MDGs is partnering with Intel Corporation and Microsoft Corporation joined to support the FCT in bringing rural youths up to speed with global information technology practices and infrastructure development to support FCT MDGs projects and initiatives. A shining example of what partnership can achieve in rural areas is the provision of a comprehensive mini water supply scheme for Abuja and environs through a tripartite arrangement between FCT MDGs, FCT Water Board, and Abuja Area Council.
That project has brought water to over 60,000 people who have been relying on river water for over 100 years. 434 solar-powered water supply schemes have been provided in different communities across the 6 area councils, along with 228 comprehensive solar-powered water supply schemes. 423 primary school toilets were also constructed to promote a healthier school environment and encourage good hygiene. As the countdown to 2015 gets closer, Millennium Development Goals programs continue to manifest in the lives of ordinary people, especially those living in the rural communities. The FCT MDGs Office continues to put people first through focused activities and initiatives that facilitate the actualization of the MDGs and geared towards achieving direct impacts in the rural communities to tackle issues of poverty, health, education, water, and sanitation.